Nursing. Test your knowledge with 10 original NCLEX obstetrics questions. Question 1. A nurse is assessing a client 30 minutes after a vaginal delivery. The client is soaking one perineal pad every 15 minutes, and the uterus feels soft and enlarged. What is the nurse's priority action? A. Notify the healthcare provider immediately. B. Massage the uterine fundus. C. Prepare the client for surgery. D. Encourage oral fluid intake. Correct answer, B. Massage the uterine fundus. Rationale. A soft, boggy uterus suggests uterine atony, the most common cause of postpartum hemorrhage. Fundal massage is the priority intervention because it stimulates uterine contraction and helps reduce bleeding. Question 2. Which assessment finding places a postpartum client at the greatest risk for postpartum hemorrhage? A. Firm uterus. B. History of prolonged labor. C. Temperature of 37 degrees Celsius 98.6 degrees Fahrenheit. D. Breastfeeding every 2 hours. Correct answer, B. History of prolonged labor. Rationale. Prolonged labor can exhaust the uterine muscles, increasing the risk of uterine atony and postpartum hemorrhage. Question 3. A nurse notes that a postpartum client's uterus is displaced to the right and is boggy. Which nursing action is most appropriate? A. Encourage the client to empty her bladder. B. Increase fluids. C. Apply an ice pack to the perineum. D. Place the client in Trendelenburg position. Correct answer, A. Encourage the client to empty her bladder. Rationale. A full bladder can prevent the uterus from contracting effectively. Emptying the bladder often allows the uterus to return to the midline and become firm. Question 4. Which medication should the nurse anticipate administering first for uterine atony if fundal massage does not stop the bleeding? A. Oxytocin. B. Magnesium sulfate. C. Terbutaline. D. Betamethasone. Correct answer, A. Oxytocin. Rationale. Oxytocin is the first-line medication used to stimulate uterine contractions and reduce postpartum bleeding due to uterine atony. Question 5. A postpartum client has an estimated blood loss of 1,200 milliliters after a cesarean birth. Which assessment finding requires immediate intervention? A. Heart rate of 128 beats/min. B. Mild uterine cramping. C. Small amount of lochia rubra. D. Temperature of 37.2 degrees Celsius 99 degrees Fahrenheit. Correct answer, A. Heart rate of 128 beats/min. Rationale. Tachycardia following significant blood loss may indicate hypovolemic shock and requires immediate assessment and intervention. Question 6. A nurse is caring for a client 2 hours after delivery. The uterus is firm, but the client continues to have heavy bright red vaginal bleeding. What is the nurse's priority assessment? A. Assess for vaginal or cervical lacerations. B. Encourage breastfeeding. C. Reassess the client's pain level. D. Assist the client to ambulate. Correct answer, A. Assess for vaginal or cervical lacerations. Rationale. When the uterus is firm but heavy bleeding continues, the source of the bleeding is less likely to be uterine atony. Trauma to the birth canal, such as vaginal or cervical lacerations, should be suspected and assessed promptly. Question 7. A postpartum client suddenly reports dizziness and weakness. Which assessment finding should the nurse recognize as an early sign of hypovolemic shock? A. Heart rate of 124 beats/min. B. Blood pressure of 118/76 mmHg. C. Respiratory rate of 18 breaths/min. D. Warm, dry skin. Correct answer, A. Heart rate of 124 beats/min. Rationale. Tachycardia is often one of the earliest signs of significant blood loss. Blood pressure may remain normal initially because the body compensates before hypotension develops. Question 8. The nurse is monitoring a client receiving oxytocin for postpartum hemorrhage. Which finding indicates the medication is working? A. The uterus becomes firm and bleeding decreases. B. The client's temperature increases. C. The client's heart rate decreases to 50 beats/min. D. Lochia changes from rubra to alba immediately. Correct answer, A. The uterus becomes firm and bleeding decreases. Rationale. Oxytocin promotes uterine contractions. A firm uterus with reduced vaginal bleeding is the expected therapeutic response. Question 9. Which postpartum client is at the highest risk of developing postpartum hemorrhage? A. A client who delivered twins. B. A client who had a 6-hour labor. C. A client who breastfeeds immediately after birth. D. A client with a normal spontaneous vaginal delivery of one infant. Correct answer, A. A client who delivered twins. Rationale. Multiple gestation can overstretch the uterus, making it more difficult for the uterine muscles to contract effectively after delivery. This increases the risk of uterine atony and postpartum hemorrhage. Question 10. The nurse has performed fundal massage, administered oxytocin as prescribed, and ensured the bladder is empty, but the client continues to bleed heavily. What is the nurse's next priority? A. Continue close monitoring while waiting for the bleeding to stop. B. Notify the healthcare provider immediately and prepare for additional interventions. C. Encourage the client to drink more fluids. D. Place the client in a high Fowler's position. Correct answer, B. Notify the healthcare provider immediately and prepare for additional interventions. Rationale. If first-line interventions are unsuccessful, postpartum hemorrhage remains a medical emergency. The nurse should promptly notify the HELT.
What was your score out of 10? Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.